Good afternoon. Today's Friday, October 9th, 2020, and I'm Terry Scoggin, CEO of Titus Regional Medical Center in Mount Pleasant, Texas. Today is our Titus Regional Medical Center community update. Every Friday, you never know what's going to go on in a rural hospital. So I love this job. I love the opportunity to live in Mount Pleasant, to live in Titus County, and I've loved the opportunity to raise my boys and me and my wife share the experiences over the last 16 years here in Northeast Texas. It's a wonderful place to live, and the people who watch this video who aren't blessed enough to live in Mount Pleasant, this area, there's some great things going on. One of the things a few minutes ago, on my way over here, I had the opportunity to stop and watch a simulation on the second floor. Our neonatal nurses, clinical staff, physicians, midwife are just phenomenal. Titus Regional Medical Center is a level 2 NICU, and we're blessed to have that here in this area. Almost 1,000 births a year come through this health system, so some great things are going on. But the team on the second floor at Titus Regional is doing some wonderful things, and they're leading the state of Texas, not just rural hospitals, but they're leading all hospitals in the different simulations that they're doing and the involvement of the doctors, of the nurses, of all the different clinical staffs that are involved. So they did a code this morning about 12 o'clock, and they announced a code and did a simulation of a mother giving birth with complications. It was amazing to watch the nurses, the newer nurses, the experienced nurses, the doctors work together on that code. We had the pediatric doctor, the one I was able to attend, Dr. Rice was in there working on the new baby. Dr. Harris was the ER doctor in there. Dr. McKellar was the OBGYN. And I just want to congratulate this team on all they're doing to improve maternal health in Northeast Texas. Phenomenal job. From a Titus perspective, we made the news earlier this week, and it was one that I'm not happy to make, but I did get a phone call at 5:05 on Monday morning and was awakened. And we did have a disaster drill here, and it was real. And we did have a bomb threat to our health system. We handled it, and I want to thank the Mount Pleasant Police Department, the Mount Pleasant Fire Department, the City of Mount Pleasant, Titus County Sheriff, and all the doctors and staff at Titus Regional Medical Center on how they handled the situation Monday morning. It was the first time in my 8 years to have something like this happen, of that disaster, but the staff and administration handled it perfectly. The police department took the lead. Our security worked closely with them, our facilities team, and we truly appreciate everybody's efforts on Monday to keep this community safe. So thank you to all. It's Friday for community updates. It means Friday football. And if you know me, I'm going to do my football updates. So I want to congratulate the Mount Pleasant Tigers on their 2-0 start. Coach Pinker heard him on the radio this morning on his weekly update. So they have Greenville tonight. It's going to be a tough game. So I want to wish the best of luck to Mount Pleasant Tigers, Coach Pinker, and all the different members involved in the game tonight. Good luck, Tigers. We're rooting for you. Want to talk about an exciting thing. We do this every year, and Tennyson Church works closely with Titus Regional Medical Center to put on this health fair each fall. I look forward to it. It's an exciting time. COVID has changed some of the things we do. We're not stopping the health fair. The health fair has to go on. But we are going to be COVID friendly, and we are going to do it a little bit different. So tomorrow morning from 8 to 11, we'll be at Tennyson Church, 3rd and Church Street, downtown Mount Pleasant, and we'll be doing a community health fair. We'll be doing, as normal blood work, PSAs, blood pressures, blood sugar, and flu shots. All this is free from 8 to 11. Flu shots will last until we run out. Last year we did run out about 10:15. So we had a lot of people getting their flu shots last year. So about 10:15. So I encourage you tomorrow morning, come from 8 to 11. We'll have volunteers all in that area. It's going to be a drive-through. It's going to be a drive-through health fair. The first one we've done. It's the first one we've seen done through our health partners around Texas and the United States as well in the rural communities. So we're excited. So I want to congratulate the team who put this together. I think it's going to be exciting. You'll see me in the middle of the street in my orange vest directing traffic. Please come join us in the morning. Don't forget to fast. Your blood work will be its best if you fast in the morning. Please wear a mask and have it in your car so when you approach us, you can have your mask on. If you do have COVID-like symptoms, we would encourage you not to come tomorrow. We'd encourage you to stay home, stay isolated, sanitize, social distance, wear your mask. But everybody else, we'd like to invite you tomorrow to join us from 8 to 11. We are excited about this, and we're excited to bring this to the community. And once again, thank you to Tennyson Church for partnering with us for the Mount Pleasant Community Health Fair. You know, things are about to change at Titus, and some exciting things. A couple years ago, we went to Epic and had a relationship with a group in Shreveport. And if many of you remember, it was a big deal. If you follow me on Facebook, we did a lot of things related to it. in a few weeks, on November 8th, you'll see a lot more posted on Facebook and on our website, and this update in 2 weeks of what we're doing related to MyChart. We will be with with the company of Ochsner Health System in New Orleans, one of the largest health systems, if not the largest, in Louisiana. We've partnered with them to upgrade our current instance of our electronic medical record to theirs. So we're excited about this partnership. The biggest change to our patients is going to be MyChart, and we're calling it MyChart Reimagined. You're going to see posters around town. You're going to see posters in places you didn't expect them. Try to blow it up and get it out there. With COVID and things happening, we're trying to rethink the way we do things. So reimagine healthcare and the transformation. Your mobile devices, your phones, your computers will allow you to access your healthcare in ways never before. We've had MyChart. It works well, but there's a lot of limitations. And wherever I go in town, I'm logging on MyChart, and other people are, and we're asking questions. But with our upgrade on November, Dr. Hester, if Josh ever had any problems with sports or anything, I felt blessed that he would have Dr. Hester to work with and help him through it. And now Dr. Pappas will be able to help as well. And he's now helping my mom. And we got the opportunity to help. We'll go with her this week for an appointment with Dr. Pappas. So we're blessed with our orthopedic surgeons here. And Dr. Campbell joined us a few weeks for the Center of Pain Management. And it's just another add-on to that opportunity for the continuum of care. Our orthopedics program and our pain management are going to be excellent. And last night I got to sit at dinner and watch this group work together and talk about where we're going from pain management, where we're going from orthopedics, where we're going to help make sure we have the total care for back and spine, that we get the relationships that we put together as a team, get the right doctors involved, so we have a continuum of care between our orthopedic sports medicine and our Center for Pain Management. So a lot more to come over the next few weeks and to follow. But if you have any of these needs, I please encourage you to check out these three doctors, check out their clinics. You can check them out on our website. But there's some great things related to orthopedic care and to pain management here in Mount Pleasant. So again, another reason to be blessed to live in this area. You know, COVID is still here. And I just had a phone call this morning with the county judge and the chief. We're continuing our disaster calls twice a week. We're continuing to work with them and follow the numbers. Our positives continue a few a day. They're not at the capacity they were a few months ago, where we were 600 a month and 500 a month. We're in the 10 to 20 to 30 a week. It's in that range. So it's still out there. I was asked yesterday by a friend, you know, are people still sick? Is it still people sick in the hospital? And the answer is yes. We average between 1 and 3 COVID patients a day in our hospital. That hasn't changed for the last 2 to 3 weeks. Usually there's about at least one in our ICU that's really sick. There is no set standard. I can look at somebody and say, this person is going to be sicker than this person. Some of your comorbidities and other things that you have could influence that your care, influence how sick you are, but we don't know just by looking at somebody. So I do encourage everybody to continue. As Texas continues to open up and more football games happen, and we start opening up movie theaters and more restaurants and things, continue to wear your mask, continue to use good hygiene, wash your hands, social distance. We're not through this. It's just we got a lot to go. I attended a phone call yesterday for an update on Titus for Texas on how we can be prepared to be one of the providers of the vaccine once it's out. The state of Texas did an update yesterday and started that process. Titus Regional Medical Center and our family care centers will be completing that forms and that process so that we'll be able to offer that vaccine once the state of Texas and the federal CMS is ready. We'll be a part of that. So we've started that process as well. More to come. Follow us and we'll keep you updated through blogs and different these updates on a bi-weekly basis of what's going on. Again, I just want to thank you. It's a great opportunity for us to live in this area. It's even a better opportunity for me to serve in this role. And to the Mount Pleasant community, just thank you. Thank you for your support. I'd encourage everybody tomorrow to join us at the health fair. This is one of our 2 health fairs on an annual basis. So tomorrow morning, 8 to 11 at Tennyson Church. We'll see you there. Have a great day, and God bless.